Hello everyone, my name is John Shirley King, and today we are going to be discussing whether or not minors should be able to obtain contraceptives without parental permission. So in 1977, the Supreme Court case of Carey versus Population Services International affirmed the right of privacy for a minor to obtain contraceptives in all states in the U.S. Although it has been more than 30 years since this law has been passed, there's still this constant ongoing debate on whether or not minors should be able to obtain these contraceptives without their parental permission or legal guardian's permission. So if we look at both points from this debate, some believe that minors are not old enough to make such an important decision due to lack of maturity, their age, and also a belief that they should not be sexually active in the first place. While others believe that we need to be more realistic and realize that we would rather our children practice safe sex rather than be at risk for different diseases and also unexpected pregnancies that could come from that. So as we examine this relationship between minors and their parents, I personally believe that minors should be able to obtain contraceptives without parental consent. I do think that they have the right to privacy and the right to their own bodies to make these decisions without needing to involve their parents in it. So a little overview today, we will be discussing different contraceptive methods, pros and cons of getting these contraceptives without their parental permission, and thoughts from actual parents, and finally just some takeaways from this presentation. So different types of contraceptives would be birth control. It can come in the form of a pill, an injection, a ring. We also have condoms, which is used highly, and we have emergency contraceptives such as the morning after pill. So types of birth control, again, we have the injection, which is also known as Depo-Provera. It protects against unplanned pregnancy 3 months at a time, and side effects could be headaches, as well as irregular bleeding, especially in the first year. We also have the NuvaRing, which is basically a flexible piece of plastic that you would insert into the vagina once a month. And some side effects could be some spotting, breast tenderness, or changes in mood. And we also have birth control pills, which is used highly. It's daily medication containing hormones estrogen and progestin that prevents pregnancy. And some side effects could be menstrual changes, nausea, and changes in mood. Next, we have condoms, which is a sheath-shaped barrier device used in sexual intercourse to reduce the possibility of pregnancy or sexually transmittable infections. So according to HHS Office of Women's Health, the male latex condom is the best method for protecting against STDs such as HIV and AIDS. They are also 98% effective at protecting against STIs like chlamydia and gonorrhea. So next we have the emergency contraceptive, which is known as the morning after pill, which can lower the chances of getting pregnant by up to 89%. You have to take it within 3 days after having unprotected sex, and just some common brands could be Plan B, One Step, My Way, Take Action, etc. So some pros to these contraceptives without permission is that it can promote safe sex, so it can protect children from various diseases such as STDs. It lowers the rates of teen pregnancy and abortion as well. It's been seen that it can lower the rate of teen pregnancies by almost 50%. So again, talking about how it protects against different diseases, I listed some here. STDs that are sexually transmitted diseases could be chlamydia, gonorrhea, hepatitis B, HIV, and AIDS, and just some more that are listed here. So also, there's protection from unwanted pregnancies and teen pregnancies. So teen births have been dropping very steadily. In 2009, the number of births to teenage mothers was 409,802. However, in 2015, the birth rate among adolescents were 22.3 births per 1,000 females, which went down approximately 46%, which you can see in the graph. And this can be due to lower rates of sexual activity, as well as people who are more sexually active using birth control. So also lowering abortion rates. It was a study conducted at Washington University showing that providing birth control for no price will basically cut down abortion rates by up to 78% compared to the national average. So a con could be that they are too young to make such an important decision. Again, the belief that they should not be sexually active at all. And also, they may not be aware of the risk as well as the side effects of certain contraceptive methods. So some risks of contraceptive methods could include blood clots, high cholesterol levels, migraines, high blood pressure, cancer, and also cardiovascular disease. So here are just some examples of how some parents feel from the CNN article. One mother wrote that although she would not prefer to have her children have sex until they're married, she wants them to protect themselves and would rather them be healthy. And we also have them just talking about, although it's uncomfortable, it's a decision that needs to be made. So I believe that we should overall put children's health first, have resources available, and also be a resource to them if they ever have questions. And although whether or not you agree with it, you should always respect their decision that they are choosing when they are getting these contraceptives. Thank you.